Medical interview simulation in English, urinary retention, and fever.
Welcome to Medical Interview Simulation in English, a podcast designed to help healthcare professionals enhance their medical interview skills. I'm your host, Dr. Satomi, and in each episode, we'll be simulating a patient encounter with a focus on effective communication and thorough information gathering.
Today, we'll be interviewing a patient, Mr. Umi Yamazato, an 80-year-old male presenting with fever and difficulty urinating. Let's begin.
Good morning, Mr. Yamazato. My name is Dr. Satomi, and I'll be the doctor seeing you today.
Good morning, doctor.
Could you please confirm your name and date of birth for me?
My name is Umi Yamazato, and my date of birth is January 1st, 1943.
Thank you. Mr. Yamazato, I understand you've been experiencing some difficulty urinating and have developed a fever. Could you tell me more about what's been going on?
Yes, I've been having trouble urinating for the past 3 days. It's difficult to start the stream, and it takes a while to empty my bladder.
And when did the fever start?
It started today, with chills and shivering. That's why I came to the emergency room.
I see. Can you describe the fever? How high has it been?
I haven't measured it, but I feel very hot.
All right. Besides the fever and difficulty urinating, have you noticed any other symptoms like pain or burning when you urinate?
No, there's no pain or burning when I urinate.
Okay. Have you experienced any changes in your bowel movements?
No, my bowel movements have been normal.
Have you noticed any blood in your urine?
No, I haven't seen any blood.
Have you had any recent injuries or falls?
No, I haven't.
Have you had any similar episodes of difficulty urinating in the past?
No, this is the first time.
Now, I'd like to ask you some questions about your medical history. Do you have any chronic medical conditions?
Yes, I have high blood pressure, diabetes, and high cholesterol. I also have depression and a history of hives.
Are you currently taking any medications for these conditions?
Yes, I take medication for all of them.
Could you tell me the names of the medications you're taking?
I'm taking an ACE inhibitor for my blood pressure, a DPP-4 inhibitor for diabetes, a statin for cholesterol, a tricyclic antidepressant for depression, and an antihistamine for hives.
Do you have any allergies to any medications or foods?
I'm allergic to penicillin. It gives me a rash.
Thank you for that information. Now let's talk a little about your lifestyle. Have you ever smoked?
Yes, I smoked 10 cigarettes a day for 50 years. I quit when I was 70.
And do you drink alcohol?
Only occasionally.
Do you have any pets?
Yes, I have a cat.
Now I'd like to ask about your family history. Are there any medical conditions that run in your family?
My father had a stroke, and my mother had diabetes.
Thank you. Now, I'd like to ask you some general questions about your health. Have you noticed any changes in your appetite or weight recently?
No, my appetite and weight have been stable.
Have you been feeling more tired than usual?
Yes, I have been feeling a bit more tired lately.
Have you experienced any night sweats or chills?
Just the chills that came with the fever today.
Any changes in your sleep patterns?
No, my sleep has been normal.
Have you noticed any swelling in your legs or ankles?
No, I haven't.
Okay, I've completed the history portion of the exam. Now I'd like to share some findings from my physical examination. Your temperature is 38.8 degrees Celsius. Your pulse is 112 beats per minute and regular. Your blood pressure is 136/60 mmHg, and your respiratory rate is 26 breaths per minute. Your oxygen saturation is 98% on room air.
Your eyes appear normal, and I don't feel any enlarged lymph nodes in your neck. Your heart and lung sounds are normal. Your abdomen is distended, but there's no tenderness. I don't feel any enlargement of your liver or spleen. You have tenderness when I tap on your back on the left side.
On rectal exam, your prostate is enlarged, but it's not tender.
We've also conducted some laboratory tests, including a urinalysis, which shows some protein, glucose, and a high number of white blood cells. Your blood work shows an elevated white blood cell count and a slightly elevated creatinine level. Your CRP is also elevated.
An ultrasound of your abdomen shows that your bladder is full of urine, but there's no evidence of kidney damage.
Thank you for providing all that information, Mr. Yamazato. We've gathered a lot of important details about your current condition. This concludes our interview for today.
Thank you, Doctor.
Thank you for listening to Medical Interview Simulation in English. We hope you found this demonstration helpful. Join us next time for another episode focused on improving medical communication skills.